So I will say my success story, the most exciting one is quite recent,
Right.
which is using an AI tool
Okay.
uh, to help the clinical experience for physicians. You wouldn't. One thing is that before before now, before about 15 years ago,
Right.
most places were on paper, right? So it was easy for you to talk to a patient, enjoy it, and just scribble, scratch, and that through, and that's
Right.
good to go. And the fact is that over time, we're now electronic, and the design was so cumbersome. Now
Right.
you find doctors spending more time typing,
Right.
placing orders, uh, and of course also addressing the codes because the codes have to match so that reimbursements can be optimal, right?
Okay.
And and doctors don't like that because it takes away from their practice. I'm
Right.
paid to actually care for this patient, not be your clerical assistant.
Right. Welcome back to the Opportunity Room, the show where we sit down with true leaders, change makers, people who are turning ambition into actions. Today's guest is Dr. Babatop Fatuyi, a Nigerian born physician whose journey bridges medicine, public health, and digital transformation. He earned his medical degree from the University of Ibadan and in Nigeria completed a Master's of Public Health at the University of Georgia and went on to earn his Master's of Medical Management from Carnegie Mellon University, a program that develops physician executives into strategic health leaders. Dr. Fatuyi currently serves as a Chief Medical Information Officer at UT Health Houston, where he leads the cutting edge work in healthcare innovation, data driven care, and responsible AI adoption. Let's dive into his remarkable journey from Nigeria to the forefront of digital health leadership. Welcome to the Opportunity Room, Dr. Fatuyi.
Thank you very much. I appreciate it, my friend.
All right, we're
Thank
looking
you.
forward to this conversation. Um, I've been chasing you all around the globe to have this interview with you, but I'm grateful that you're here today.
No, it's my pleasure. Thank you. Thank you very much for having me. Thank you for giving me your platform to share my story. Yeah, I appreciate it.
Absolutely. So let's start from the beginning, right? So just tell us a little bit about your journey from Nigeria all the way to the U.S. How was your life like in Nigeria?
I mean, I have a feeling that we all kind of have similar livelihoods, coming from Africa, West Africa, regardless of economic affordability, so to speak.
Right.
So I want to believe my life was good, but of course we suffer the same type of desire for better,
Right.
especially in my field where I felt that the West has better opportunity for training in
Right.
my field. And I just wanted to take advantage of what is possible to get the best possible kind of training and learning in the West. So I still have a lot of family and friends back home who are doing very
Okay.
well in whatever they set their heart and time to do. So I would say my life in Nigeria was same good, bad, and ugly, just like many
Right.
people, in just
Right.
taking advantage of opportunities there. And there's that general saying that the grass is always greener wherever you focus and wet it. And
Right.
having left Nigeria, having lived here in the West, and realizing that if you don't wet your grass here, even in the West, it will not be green.
Absolutely.
So the same power and same energy, so to speak, and self application of self back home. So my life was we had the good, the bad, somewhat challenging too, but we'll always overcome through our Creator.
Absolutely. You couldn't have said it any better. So now I know you started to study medicine back in Nigeria, right? So what inspired you to pursue medicine growing up in Nigeria?
Well, the singular factor for me pursuing medicine is my father. My dad wanted a doctor in the family, and he and my mom decided to encourage me and help me see that there's an opportunity here. He
Right.
believed that if I'm a physician, I will always have a job for life. That was
Yeah.
his strong belief, and he wasn't wrong at the very least, so to speak, because what you learn as a physician, you will always apply it
Right.
in forever. But then what we didn't know then was the business of medicine is totally different from the art and the practice of medicine, which
Right.
really means two different things. But then I I did that because I was encouraged really by my parents.
Right.
And they both modeled service, and I saw that growing up. Um, uh, in my journey too, why I actually stuck with it was me seeing both the ingenuity and the gaps in our health systems. After I decided, okay, daddy, let me try. In my pursuance of the art of medicine, I saw how single well-timed interventions an accurate diagnosis, really, a well in time referral, even a clinician encouragement, could alter a family's trajectory. At that point, medicine felt like the most direct path to impact. And later, I realized pairing it with system thinking could multiply that effect, is the reason why I then pursued a master's in public health at the University of Georgia. Found myself consulting, and now I actually just actually not launched, just graduated in May from another program in Carnegie Mellon University,
Right.
master's in medical management, which is equivalent to an MBA. For health services, but particularly catered to physicians. So that's been my journey so far.
Great. So, did you get to practice in Nigeria before you came to US, or you didn't get to practice at all? You just finished school and moved to
No, I did. I did practice for at least 3 years.
2 years.
Yes, three years.
Okay. 3 years. Okay.
Yeah.
So now, was there a difference when you came here and you landed your very first job? Tell us about that journey. Did you come straight to school here, or did you just come and study? Went to university to actually kind of acquire more skills, or you just went and just practice immediately when you came to the US?
So it's very difficult to just come to the US and begin practice. So
Okay.
you still have to do those equivalent exams. You gotta
Okay.
do your boards, your step one, step two, CK and CS, and then you do your step three at the time to get the ECFMG, which is a certificate for foreign medical graduates, so to speak. So I was doing those exams while I started prepping back home.
Okay.
And of course, the training I had from the University of Ibadan, trained me critically, rigorously, and resourcefully. So we learned a lot with a little, honestly. But then, with the heart set to come to the US, so to
Right.
speak, one has decided to start getting all those materials, all those prep materials in. But my journey to here was as a student. I came here as a student at the University of Georgia, as I mentioned,
Okay.
and of course that requires focus, so you can graduate with that because I
Right.
believe in finishing what I start.
Right.
So while doing that, I was still prepping for the boards and all. So and that is a total different kind of preparation
Okay.
than my style of training back
Right.
home. Even though we know the content and the stuff, but you got to pass the test first.
Right.
So that self application began to change my foundational understanding about learning, education, and training as a whole. So I didn't just come to practice. I had my master's in public health and did some clerkships and rotations here and there. And even after getting my certificate for foreign medical graduates, was at that point was when I found myself either go that route or go
Right.
the path of healthcare administration leadership, and
Okay.
follow the path of administration and leadership within the area of technology
Right.
at the time, because it was just the in thing. There was so much need for our services. The tech world needed many people who really will focus on understand what's going on there to be able to explain that to colleagues within the healthcare systems, and that's still what I do today, which is the service of my colleagues and in everything I do, service of physicians, service of the support staff, everything that has to do with healthcare is what I put my heart to help improve in all of that.
Great. So, how long did it take you in the University of Georgia to finish all of that preparation and all of those exams for transition? I know it's
For
different for everybody, but how long did it take you?
No, for University of Georgia or University
Yeah,
of Ibadan?
yeah, from University of Georgia to finish all of the
Um,
transition, all of the exams that you needed to actually
it,
become legit, quote unquote, in US.
yes, it's self-paced. It's
Oh,
by
it's
you.
self-test. Oh, okay.
Yes, so for me, it took me average, because I started before I got here anyways, maybe 3 4 years to get
Okay.
all of those exams in. But then maybe it could have been shorter, but for sure, because I had the school, I had to adjust the fact that I lived in London for about a year first
Okay.
before coming here.
Okay.
which was my first time leaving Nigeria
Right.
ever.
Okay.
It already kind of helped me with expectations because the culture shock when I moved to the UK was so much on me. But with that coming to America, it became so easy. It was so much easier, rather, uh, uh, because I left home first for about a year,
Okay.
and then coming
Okay.
here, and then being in an academic, a school culture and environment, which was
Right.
very structured with just a lot of things to do, and
Right.
having colleagues, and not just being lonely and waiting and thinking of what to do.
Right.
That really helped me assimilate and settle better than ever.
Now let me ask you. So you from Nigeria, you went to UK first, right?
Yes, I
So
did.
why didn't you choose to actually pursue your career in UK? Why did you choose US versus UK?
I will always joke and look at myself in the mirror as a kid and tell myself, listen, I'm American.
Oh, really?
I'm going to leave this country soon, anyways. Even though I never had a path, I didn't even know.
Right.
My parents never really encouraged me to think like that, even though they supported it underlyingly. When I graduated college, I had a lot of friends, high school rather. I had friends who were born in America and who left immediately. Of course, those were my tight friends. I really wanted to be with them.
Right.
So I did all of the SAT exams, all the TOEFL exams at the time that was necessary. Uh, yeah, I got admission for undergrad here in the US. I tried to get my dad to sign and let me go, but he
Right.
wouldn't. You're too young. I can't let you go.
Right.
Uh, After your medicine here, after your college, then you can go. If I had my way, I would have left without his consent, but I didn't, and I'm glad I didn't because
Right.
my journey in University of Ibadan was so ingraining, was so deep. In hindsight, it's definitely what shaped me in character and in learning. That's our normal mantra in essence. It's not just academics because even what I use to carry out my day to day job now is beyond. It's definitely not the art of practice of medicine, but
Right.
the knowledge of that, the human interaction, both at work and outside of it, the ability to be a leader.
Right.
It's all was born and crafted, so much refined at the University of Ibadan from all that I've been exposed to. And definitely building on that has been a deep, great changes. So thank you, Daddy, for not supporting at the time that you did. And of course, when it was time for me to come, he was really on it, man. And my mom, I never want to forget that.
Right.
Both of them, they till today, they've been very supportive still.
That's great. That's great. We like to see more of that. Um, did you have a welcome to America moment? Because I usually ask those guests because usually immigrants they have a welcome to America moment. Did you have one?
Oh, I have a couple really,
Okay.
but one that stands out for the
Right.
sake of which is not really related to academics per se
Right.
was I lived in London as I said before I moved here,
Right.
and in London you move around trains primarily and
Okay.
buses. That's what we do. That's what we
Right.
did. I had
Right.
this bus 53 that I liked, because that's what takes me through the area I was leaving.
Right.
And in coming to America, I had a friend who was living in Ohio, so I wanted to go visit. Now, getting on the bus, just carefree because you don't assume anything.
Right.
So I got on the train when I went to Ohio from Georgia at the time
Right.
just to visit. My first visit, I think, first month or two,
Right.
from being in the protected environment of college, just
Right.
coming out of town.
Right.
I got jumped on the
Really?
bus. It was so bad.
You talk about
And
on the bus.
on the bus, I sat down beside a group of people,
Right.
and I was comfortable. Hey, look like what you do innocently.
Right.
And I mean, just basic pleasantries and the
Right.
likes. I got really jumped. I got stripped of everything. It was so
Wow.
fast that I didn't even know what happened. So
Right.
I ran to the driver, who happened to be a female, and he told me, just back off. I don't know you. I don't know what you're about to tell me. Just get out.
Wow.
So I was flustered, so
Right.
confused, and my IDs, everything I had. So I had to get
Wow.
into a bank, explain myself. I actually don't even know how I figured that out, but I did.
What
That
a
that
story,
really,
man.
yeah, that really changed my trajectory. But then he also exposed me to understand that we as a people are a product of our upbringing, regardless of creed or
Right.
race. So
Right.
if I was brought up in certain ways, that's the opportunity given to me, so to speak. Over time, I learned more about people. Over time, so beyond my total understanding of generalizations and the
Right.
likes, that experience, amongst others, helped shape my understanding that people are people,
Right.
and it doesn't really matter for the most part. Our exposures, our upbringings, definitely shapes who we become,
Right.
and is not a function of certain group creed are all 100% generalized to be X, Y, and Z. Uh,
Right.
so that was my welcome to America moment. Like, hey, you got to be about it. Wake up, focus, protect yourself at all
Right.
times.
Right.
Always guard. Because you
Right.
never know where that hit is gonna come from.
Be aware of your surrounding. Absolutely. Absolutely. That's an interesting story. So now let's just pivot a little bit and just talk about your masters of public health and at university. So what drew you towards doing health policy and management? Because that's totally different from just practicing, right? So why did
Yes,
you choose to do that?
I spent a lot of years in medicine,
Right.
and I it was when I assessed my path to live in Nigeria at the time. It was best as a student, to be candid, and most of my colleagues were doing the same thing. So I looked for an applicable program, and in this case, I felt now that I'm clinically legitimate as a physician to treat
Right.
patients, and
Right.
I'm saying, okay, I could help one patient at a time. That's the power I have.
Right.
If I see and I trajectory that, okay, how many patients I'm going to see in a lifetime if I started X, Y, and Z, and it was capped at the thing.
Right.
Now, there's nothing wrong with that, because the value for one patient could be a lifetime of change. Doesn't matter the number of people that you see, really doesn't.
Right.
But then I'm like, okay, if I do a master's in public health with policy and management, which is my focus, I could help communities. So the master's in public health gave me the language of systems, financing, quality improvement, population health. So it's also trained me to measure outcomes, not just efforts. So an essential muscle that I use now for many of the digital transformation work that I do now.
Okay. Nice. 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 And then you didn't stop there. You went in to do another master's of medical management from Carnegie Mellon, right? So
Yes.
why did you decide now to pursue again like another master's in medical management?
So I believe that you have to refresh yourself one way or another,
Okay.
through certificates, through whatever tests, exposures. Just you gotta be about the current, no matter how comfortable one feels in life. So after working around the country as a consultant and getting my full time opportunity in my current job, and so I felt that, man, I need to to get back to I need to improve where I'm at, and at least just make sure I'm current, so to speak.
Right.
And I decided to do an MBA, which uh, and then I had the option to go traditional MBA or do
Right.
a master's in medical management program, which caters to only physicians, physician executive leadership.
Okay.
So MMM sharpened my physician executive opportunity. So it gave me disciplined strategy tools, value cards, stakeholder mapping, and return on investment pathways, uh, and pressure tested them on real problems because that's the life I live at work now. So
Right.
the MMM program also honed my translate across domain skills. So
Right.
speaking clinician work, speaking operator work, speaking data scientist, and understanding the CFO in the same meeting. Managing all of these different brilliant individuals and without losing the plot. So that really helped me uh, see the tools and how with case studies and just a lot of learnings in that aspect. Ultimately, it definitely gives me the opportunity to provide better care, safer care, and simpler care, not just from an individual standpoint, from both a system thinking perspective.
Okay. So when you're doing like physician executive and thing, do you get to still practice, or you just now you are the actual lead of all the physicians and just telling them pretty much drafting plans of how we should handle patients, how we should handle finance and all of that. How does that work wearing that hat? Is it just you practicing, or you're not practicing anymore at all?
So I am not practicing anymore, and I
Okay.
actually left that just to manage because managing those two is two different
Okay.
worlds, really. They're
Okay.
not entirely the same. So
Okay.
I decided to focus on informatics. I decided to focus on physician leadership. So my
Okay.
job primarily, I'm the face of the electronic medical record, anything that impacts physician utilization of the tools. So multiple vendors speaking to one, so to speak. So I lead a team that builds, design, what those users enjoy. I use the tool that helps patients have access to the records on different applications as a whole. And of course, I don't lead it by myself. There are other leaders, other team leaders, other
Right.
executives who own different capacities and different spaces. So I, I help physicians enjoy their practice through designing real products and tools that will help them carry out the jobs in essence.
Okay.
I'm the hotline when they're excited about a new opportunity. I'm the hotline when things don't go well regarding those tools. So I have
Mm.
to find a way to take care of that need, either by explaining clearly to the technical teams and just
Mm.
finding a way to find a solution. Sometimes there's no solution, and I have to bear
Right.
that use in a sense. Sometimes it is what it is. It's clunky, I know, but for now, this is what we have. And many times we can improve those workflows, we can improve those processes, we can find a balance between what is asked for and what is possible, and lock that in. So that's what I do.
All right. So now, what was? Can you just tell us maybe one of the success story that you had? Since you start wearing this hat, one of the success story that you help, for instance, physician just make their life easier by providing a particular solution. You don't have to give the exact project, but what are some of the things that you were able to do to help the physicians?
Honestly, the truth of the matter is that I'm so high level and enterprise focused
Okay.
that by
Okay.
the time I come in, the physicians already they've made the case, as a
Okay.
group.
Okay.
So I will say my success story, the most exciting one is quite recent,
Right.
which is using an AI tool
Okay.
uh, to help the clinical experience for physicians. You wouldn't. One thing is that before before now, before about 15 years ago,
Right.
most places were on paper. Right. So it was easy for you to talk to a patient, enjoy it, and just scribble, scratch, hand that through, and that's
Right.
good to go. And the fact is that over time, we're now electronic, and the design was so cumbersome. Now
Right.
you find doctors spending more time typing,
Right.
placing orders, uh, and of course also addressing the codes because the codes have to match so that reimbursements can be optimal, right?
Okay.
Doctors don't like that because it takes away from their practice. I'm
Right.
paid to actually care for this patient, not be your clerical assistant,
Right.
not
Right.
document on all of these things. The patients don't also like it because you find doctors, hey, hold on a second, they're going to turn their back on the patient just to quickly, depending on the design and the layout of the clinic.
Right. Right.
Um, uh, and you can't expect them to carry laptops everywhere. That's not the better experience. So, with that said, now, and at the ED, some doctors or practices, orthopedic surgeons that can afford, they will hire a scribe, someone who will help document while they focus on seeing patients because that's a
Right.
better experience for both the doctor and the patient.
Right.
Fast forward to what I've done that really is so exciting now, an advantage of the cutting edge AI solutions that exist as a whole.
Right.
So myself, the organization, and my team definitely brought in many vendors who would help, who were actually marketing to us on these AI scribing solutions.
Right.
These solutions whereby we're talking is actually capturing our words
Right.
and writing it in medical terms, not
Right.
just transcribing as it is.
Right.
Write it like I will write a note about a patient. Also
Exactly.
putting the subjective assessment, the SOAP plan, including the assessment and plan, objectives, all the examinations and all the likes. So now we've implemented this AI scribe that allows
Right.
almost any doctor, as long
Right.
as you get the license to do that, to through your phone, just drop the phone, talk to the patient, get a consent, of course, from the patient. Hey, we're going to use this tool to capture our conversation. It gives me the
Right.
ability to have a better experience with you, and I can take care of you better.
Right.
And the beauty of it is you have to speak, you have to talk for it to capture it. So
Right.
you find doctors explaining even better than they would normally do.
Right.
Just they can have the right documentation,
Right.
and that has saved a lot of time
Absolutely.
because with that you find people going home as a 5 p.m. when they're supposed to go home.
Right.
Prior to that, most doctors go home at 7. And even when they take go home 7, they still carry their work with them
Right.
because they still have things to capture. So
Right.
this solution is something that is exciting to me. This solution that gives me joy in the sense that for once in a long time, physicians actually appreciate the fact that they can have this tool help them take notes.
Right.
All they have to do is read through it. Of course, because it's AI, it hallucinates. It doesn't
Right.
always capture that 100%.
Right.
And that's where, because it's fresh, you quickly do your notes, make changes as necessary. At 8 out of 10 times, you don't need to make changes based on the reports that we've seen at all. But those
Okay.
2 times, and that's where the doctor is always in charge, no matter the tool that is provided to him. A majority of doctors do like this solution. I'm happy about it because it improves the patient experience, improves the doctor experience, and it improves the diagnosis, in essence, the codes necessary recommended. It definitely improves the well-being of the patient, of the doctor, which I care about sincerely, and the well-being of those surrounding and helping the doctors doing the practice, which I also do sincerely care about. So AI scribing is something that I love.
No, I think it's a great win. Believe me, although I don't work in that space, but I believe it's a great win because there's often time I always wonder that I always when I go to the doctor for regular checkup, I see them doing a lot of typing. I'm like,
Yeah.
how can they really focus on just typing and at the same time
Mhm.
capturing this information correctly, think them
Mhm.
correctly, and
Yeah.
just having that experience with the person with the patient go
Mhm.
well because sometimes you're like this doctor is he really listening or he's just typing so I think it's a great win that you're able to have some people actually adopt that technology and leverage AI the good way because a lot of people are just looking at AI as a threat rather than an opportunity.
Yeah.
So along those the journey in AI and in different technology, is there like a barrier that hospital facing when they're integrating technology with patient care?
Yeah.
Yeah.
The barriers, is a lot depending
Okay.
on the maturity of the organization you find yourself, depending on the level of assimilation of your users. In essence, just a lot of factors really.
Right.
Keeping clinicians in the loop is key. You know, those because that's very important. The safety by design, in a way, is also very key. Legal compliance, so just just a lot of challenges, but
Right.
for sure governance is key, leadership adoption is key, no matter
Right.
what you do. In the leaders of hospitals, even if they're physicians or otherwise, they have to follow through a process. You don't have money, there's only so much you can do, isn't it? um, so when we talk of barriers, funding for sure, because there's a lot of competing needs. Everything doesn't have to be because the doctor said it. No, now we got to do it. So funding is a very, very important piece to what we're talking about. Um, uh, Beyond the funding is it depends on, does it help just one patient? Does it help a lot of patients? Does it help one doctor? Does it help a whole enterprise? We need to do the pros and cons as
Right.
to where the decision that we're talking. Does it save time? Does it provide efficiency? How does it help with revenue? Just a whole lot of things to consider.
Right.
And lately, one has to consider the health of the new adoption. How tested is it? How long lasting will it be? How much of value will it be in the long run? Because you find out that you bring in some vendors and opportunities, and before you know it, you're not even done implementing, and they're actually thinking of closing down because they can't sustain their own business as a whole. So just a lot of factors, and there's nothing new under the sun when it comes to this. But for us, uh, help we governance is heavy, leadership presence. If they're interested, if the leadership is interested,
Right.
then it's easier to work with the leadership that cares.
Right.
For which I'm so blessed to be where I am, because despite all of the challenges happening, uh, with funding, with all the cuts, with the government, with all
Right.
the challenges associated, which that will forever exist in any
Right.
situation, one way or another. The people centric approach to managing the needs is just very brilliant for the organization that I work. So very inclusive in a lot of ways. And with that, just managing our people and the expectation really along the lines of what I talked about, which is along the lines of just justifying why we do what we do at the time
Right.
that we do it is very critical.
Right. Good. Yeah, I know challenges will still, be present, and you'll deal with many as we go, because there's an ever transforming ecosystem right now, with all this government shutdown and all these things going on. Um, Now, I believe, if I'm not mistaken, you've also led digital transformation at NYC Health and UT Health, right? So, what were some of the leadership lessons that you learned while managing such large systems, man? Because those two entities, they are huge entities, they're huge organizations. So, what are some of the lessons that you learned that you could probably share with the audience?
My lessons in New York was a life changer for me, but as a
Okay.
person and as a career path. Again, as I told you, when I got into this path, I didn't know what the future held. It was just following
Right.
the path of least resistance. I'm compensated significantly, learning through it, and I seem to be a little better than the next physician in this aspect. I put my time on that because
Right.
I'm spending my own time and training, understanding the product, while my other colleagues are doing the best thing, which is learning to be better physicians and caring for us, which is all
Right.
of us, our patients, anyways.
Exactly.
So I enjoy that piece. New York again, big city. Okay, I was working downtown, financial districts, the Water Street, really a whole life changing experience. A kid coming from Lagos, Nigeria, and you find yourself here. And New York City Health and Hospitals the scale of the work taught me pragmatism. 5 boroughs, 11 hospitals. I was CMIO, interim CMIO for Elmhurst and Queens. Just crazy politics at the time too, because we were working closely with the mayor and Mayor de Blasio at the time, who definitely wanted us to go live by any means necessary, which was the right move because they had invested in this 2000 about 5 years before, but they couldn't just implement and run with it. So of course my bosses got brought on to help make it happen. So I was one of the few who led that implementation there. Uh, it taught me pragmatism. It taught me pilot thoroughly,
Hmm.
standardize fast and measure relentlessly. So that's what New York taught me. And
Okay.
at UTL Houston, governance matters. Oh my
Okay.
goodness! No matter what you do,
Right.
uh, governance and inclusion, because and it's not a function of title. If you're listening today and you learn anything from all of this conversation,
Right.
title is good, but for you to function, your inclusion definitely is not a function of title. So whoever can help advance the cause of the organization, you have to make sure that you include them very well, so you can match in the same tune. Um, uh, uh, at UT, we have clear charters, good champions, a lot of clinicians who want to be part of what we do, which is such a blessing because they're the ones that use the system. They want to be part of it, so they help drive how we carry about it. And when things don't go right, they are part of the solutioning
Right.
and they are part of the wait process. Just that transparent prioritization that comes at the end of it too. So in both places, the best tech would fail without appropriate change management. So the soft stuff is the hard stuff. So change management it will be what I will say I learned a lot on, and that includes a lot of inclusion uh, from everybody.
When you say inclusion, are you referring to people buying into whatever you're trying to do, or all the stakeholders from different areas of the hospital of UT Health actually coming together to provide a solution? Is that what you mean by inclusion?
More or less,
Okay.
more or less you have to design your stakeholder inclusion process, right?
Okay.
If I'm gonna need to make sure a solution has passes the security test, right? If I'm gonna need it to be compliant, if I'm gonna need legal backing, if I'm gonna need the doctors in the particular unit to use a process, then it has to fit into their workflow, and I have
Mhm.
to bring them on at the beginning, not after the fact. These are live lessons, so it's not every time that we need everybody, but you have to have a checklist of all of the stakeholders that are important to your success.
Right.
So in this case, yes, if you need a whole university to use the system, you have a roadmap of inclusion. Of course, you can just get a microphone and start yelling at everybody to come to your dance, but there's a process. There's how you start next, onto the next, onto the next, until it's done. So you can't just nearly really rush through anything. There's no point, because you can rush through it. By the time it gets to the clinic and is not properly vetted, tested, and run through, you definitely have a problem in your hands. They cannot use it because you're affecting their process and the workflow already. And before you know it, you run into some legal challenges because you didn't follow the right process, in essence. So if your MA or your nurses are not part of the process earlier on, then you find out that you're putting the cart before the horse, and it's always going to be clunky. When we talk of balanced innovation, so to speak, with workflows and safety, yes, putting the right people in the loop earlier on, even if it's for their awareness, so they can always give you contribution and have access to feedback, very, very helpful in a lot of ways.
Yeah, this is pretty similar to how we actually. I'm surprised that because while you're listening, while I was listening, I'm just mapping what you're saying with our processes, which is pretty similar because I work in IT, right? And uh, yeah, I'm sure it's pretty similar because when we're doing how we're handling project is we used to have the waterfall methodology versus the agile methodology. And what you're saying remind me of the agile methodology, where we include everybody early on the stage and just make sure that we get their feedback throughout the life cycle of the project, rather than just gathering all of the information from the beginning and not including them till the end of the project. So it
No,
makes a big, big, big difference when everybody just aware of every single step of the project and just can provide feedback as we move through the project.
you were so right. Mentioning agile and all of the Six Sigma and everything in between. We have a team that brings that into the game. I depend on them
Okay.
to help. So what I mentioned as a profile or a portfolio or a process is what I depend on them to help us do.
Right.
So it's the same thing. Shades
Okay.
of gray, same thing expressed by you from a core IT perspective, same thing
Right.
mentioned by me because I work with IT in
Right.
healthcare. To
Right.
I spend my hours more with them,
Right.
than with the physicians. With the physicians, me understanding, taking care of them, and that first direct hands. And
Right.
many of the work process works with IT to actually create and craft that. Project management is heavy, and we definitely depend on them critically in being successful.
All right. That's good. Good stuff. I learned a great deal. Now, I know I probably should have asked you that question early because when you were mentioning how you're leveraging AI,
Mhm.
and I see a couple of quotes or couple of documents or messages on your LinkedIn post
Mhm.
regarding AI. How should healthcare institution approach AI responsibly now? Now it's still not mature. Everybody's just struggling. In tech, in IT, in information security, we're struggling with it. In different areas of life, people are struggling
Mhm.
because it's at an early stage. How should healthcare institution approach AI responsibly, right?
The healthcare, this first time I see healthcare not being such a laggard, when in adopting, especially the Gen AI piece of it.
Right.
Just about less than 5 years ago, this
Right.
just came about, ChatGPT and everything in between. And now we're full integrated into healthcare. Of
Right.
course, Microsoft, Nuance, DAX, with Epic. We have Abridge, and we have tons of firms and companies all in this space
Right.
providing cutting-edge solutions for healthcare. Where I work, we do have a host of programmers, developers, experts, data scientists who are deep into this. Healthcare definitely need to not need. We're already in it,
Right.
and then we have to. dance around balancing AI's promise with patient protection, what's responsible and everything in between. Uh, that I would say, uh, first again, leadership night, let's go, let's do it, let's see what we can do. And it's not a function of just endless funding, it is just the support to actually get this going. We have the right staff, we have the right folks, be it internal, created solutions, or we're partnering with vendor. And for that, I would say we'll start with use cases. What use case will help us reduce burden and improve access, reduce inefficiencies? What what use cases are quite redundant that we can automate to help improve what we do? So, and then we mirror that with solutions that perhaps we need to homegrown create, or if we have a vendor that already has the well-tested solutions, we engage and what that would look like, and map that with possible uh, ROI in that. This definitely will require governance, model cards, we'll do a bias check, some PHI handling, how we're going to do all of that. This also requires a deep human oversight,
Right.
and the ability to run audits, some audit abilities, just to make sure we protect the patient, protect ourselves in the business that we run. And running limited pilots with clear exit criteria is very, very powerful. So we push the results internally and look, and if we can scale, then we scale. And this is coming from us creating internal solutions, honestly, where where starting small departments, limited departments, move to a bigger one, having human oversight on that piece, uh, and making sure that even while we scale on that, we address safety, we address equity, and we demonstrate valuable return on investment. And that is a whole topic on itself, because sometimes everything is not cash. The return on this investment sometimes is hours saved by folks. We don't need to get rid of people per se,
Right.
but we save the hours, and this person can be functional in other areas. Gives us better productivity. There's satisfaction with the user, because these are mundane work. And then we use, and a typical example, let me just put it out there, is us improving and automating our fax systems. So you realize that people still do faxes these days. Go figure, right? A whole thousands of faxes, millions really in some instances. Now, and you know how the faxes look, not very clear. So we've used in that workflow many times patients are expecting quick returns, and the front desk is working the faxes, but it hasn't gotten to your case yet.
Right.
You think that they didn't send the fax, you tell them to send it more. Now there's two, three, four messages, same request,
Right.
duplicity of needs. So you have that backlog, and all. So we created a solution which is called IDFAX, and that solution definitely uses OCR and natural language processing, which are all sub terminologies within artificial intelligence, to
Mm.
help read these faxes, index them, read them clearly, and help process what humans will do in squinting and finding this information. It reads all that and discreetly maps them. Where so you don't need to do all that clunky work anymore. All you have
Right.
to do is make sure, verify, and then commit.
Okay. Okay.
That went through this, all of the initiation, all of the testing, all of the stakeholder partnerships, and that's some, it's not just easy. It's hard, working with people. Intentions have to be refined continuously.
Mm.
That auditability and transparency is very key. Patience, lots of patience,
Right.
um, especially when you're working not as an entrepreneur. These are entrepreneurial processes, so you have
Yeah.
to give yourself grace, give the people grace too, in getting to where you want them to be. So that solution, at least now we've done it. We started with a small department. Now it's widespread across our factory practice at least 90% of the time. So that's what we have.
Okay. All right. Great. So let's just lighten up the conversation a little bit. I think we got extremely technical, and some
Nah.
people probably will give them a headache by listening to. But yeah, it's part of the process. Now, what advice, right? I know there's a lot of people just struggling to figure out just what career path they will take, right? Some people want to just get into medicine and just be in practice. Some people just want to. This is my first time hearing about actually policy management and executive for the physician. I never heard of that before. So this was a learning opportunity for me as well, and I'm sure it's going to be a learning opportunity for people that are listening and struggling to find a career. So, what advice would you give people struggling to find a career if they wanted to get into medicine? Uh, what advice would you give those people?
So advice for young kids or young people who want to do medicine.
Either young kid or professional who wants to pivot like you did, right? Because you pivoted in the middle of your career and you and started doing executive physician type work.
Mhm.
So, what type of advice would you give either a your younger self or a seasoned professional who wants to pivot and change their career path?
To hospital, to IT leadership work, or I'm trying to understand the question. Is it younger person who wants to do medicine,
Who
or
wants to
someone
do
who?
medicine? Who wants to do
Oh,
medicine?
okay. To do medicine is the easiest part. You know,
Right,
do you have it in your heart? Do you want to do it? That's the first
right,
thing. Do you want to do it?
right,
Is there is only different so many there's only so many pathways that you can go to be
okay,
a physician.
okay,
And if you want it bad enough, you will get it. That's just the truth.
right,
If you want it bad enough, I went to medical school in Nigeria. Every country has medical schools.
right,
They have their entry process, they have their exit process, and the likes. You can practice anywhere you want in the world.
right,
Every part of the world welcomes doctors.
right,
You just have to decide where you want to go, why, and follow the process, respect the process. Some countries don't need you to do the exams again, like the US. That's fine. They accept your training as is.
right,
That's fine. Some countries like the US want you to go through their own residency again. You want it, that's the process, do it. It's that
right,
simple.
right.
I will only just encourage that there's no better time to be medicine to be a student than now. There's no better time.
Why
When
is
I
that?
went to school, I had books that I had to read that
Right,
were British books,
right,
that were American books. My imagination just had to be on point. My learning was you have to be brilliant. Let me just put it in hindsight
okay,
to be creative in understanding many of these concepts and all. But now you have AI solutions that can help you prepare. Any I didn't have any self-paced solution like let's use cloud, ChatGPT, Grok, or Gemini.
hmm,
If I want to understand a concept, I could ask it, can you break this down to me like a kid? I can ask it to give me a scenario I can understand. I like to learn with stories. Come
right,
up with a mnemonic for me. Give me options.
right,
Those things I did by myself. I need to
right,
get a mnemonic for these things. Some mnemonics are already in existence. Yes, that works if it works for you. Sometimes those mnemonics don't work for me because of my ability, my way of thinking. In a nutshell, if you want to be a doctor, you are the only one stopping yourself. Go for it. If you need to take loans, do what you got to do. If you need,
right,
let your family and friends know. Get the support system that you need, and let them know one day I'm going to
right,
do it, and just go for it. It's easier to be a doctor if you have the heart and the will
right,
than to be anything else, really,
right,
because standard exams exist. These are the things you need to do.
right,
Follow what you have to do, and age is not a barrier.
right.
I've seen people graduate from medical school at 50, 55, even 60.
Really?
But you wonder, okay, dude, what do you need it for? That's been a lifelong goal. And at the point I was at a crossroad in my career, and I decided, I think I want to do this now. And they go for it. You can go to med school here, you can go to med school in Europe, you can go to med school in the Caribbean, you can go to med school in Africa, you can go to med school anywhere.
Right,
So to be a doctor, you just decide
right.
and do it.
Now that's good. I have a follow up question on that because since you took a different path after practicing,
Hmm.
I wanted to know if today I'm in IT, right? For instance,
Hmm.
if I wake up and truly like the interview that we have, the conversation that we had today, and I'm like, okay, I really want to impact now in the medical field. I know there's IT, like we're leveraging Epic and things like that. They have IT gears towards technique, medical associated area or domain, right?
Hmm.
So if I wanted to just go and get my master's as a physician executive, like you did, master's in medical management, right?
Hmm.
Would it be something possible, or I still need to have a prior medical background before doing that?
So there are two prongs. You right now can just honestly do an MBA. If you're having
Right,
an IT with an IT and you're working in a hospital healthcare process,
right,
follow that process.
okay,
It's all about service, whether you're a doctor or
right,
not. What we do at the
okay,
core of it is service. Service to
okay,
self, service to those around you, service to your health systems, yeah, as a whole. There's a lot of people that we cannot function without, sort as
right,
our infrastructure guys in IT, those who manage those data base, the cloud management guys, all of the Azure
right,
guys who save all those
right,
data. Many like the core, like we're dependent on IT to have a good day in the office now. If
Right.
things don't go right on a day with IT, we will not see patients.
Right.
We cannot. Anyone can actually maybe can get that job,
Right.
being a security, data security, helping with ServiceNow, for example, which is a ticketing process and as a whole, working with
Right.
Epic as in some interface capacity, you know,
Right.
uh, with uh, with Rhapsody, the whole thing, just a whole lot of opportunities when it comes to interface and bridges and all the likes.
Right.
That's that space. Those are the people that I work with. They're not doctors, but they have that deep interest in IT and they happen to work for it in healthcare.
Right.
As a physician,
Right.
you can either do your core MBA and be with everybody, or you do the kind of MBA that I did, which is the Master's in Medical Management. You have to be a
Right.
physician to be in the program for MMM. You have to be a doctor.
Mm,
If you're not a doctor,
okay.
you can come in. So you curate, and I enjoyed it a lot more because I'm with folks who thinks like me. And they can guide us together. Okay, you're thinking this way. Typically, this is not how your other executives think. This is how to think like them and get the best out of them.
Okay.
Voila. So if you are a medical student, someone in medical, you're a doctor already, I would
Right.
strongly encourage the MMM program because
Okay.
there you have more friends who are doctors doing the same thing, help talking about
Right.
health administration and leadership, and you can help each other with the same mindset to
Right.
survive. Where you need the non-doctors who are leaders to actually
Right.
get through. Right? Healthcare definitely needs the success of other industries to actually measure up and advance in a very progressive way. Yes, we have to protect all the HIPAA, all of the information that's something on its own.
Right.
But by and large, bringing the cutting edge front and center thought process of other industries to healthcare is such a huge win, right? And bringing an engineer, bringing a successful banker, bringing those guys to come lead healthcare hospitals with their experience into boards or into supporting your teams, groundbreaking, very helpful and very important. And for those who want to do that, by all means, either you're a doctor, non-doctor, there are two parts. And I'm not even telling you to do MBA or the program that you need to. Apply yourself really in that aspect. Take other courses, hospital administration, leadership opportunities. It doesn't have to be MBA, it doesn't have to be masters. There are independent programs. You can teach yourself really. You got a job, you're in the hospital system. Okay, you don't have a job. Go to your local area, and volunteer.
Right.
Make friends because at things that we do, wherever you are, it's
Right.
all about network, friendship, service to people, and
Right.
your opportunity will never miss you. Because if you don't if you think that this is all about money
Right.
or if it was all about what I'm going to be paid and things like that, you're going to miss the plot.
Right.
At the core of it, yes, we need money. We need to survive. We need to feed. We need to protect our families.
Right.
But you can't put that at the front end.
Right.
Service is key.
Right.
The heart of service is 100%, regardless of doctor or non-doctor.
That's great. That's great. I definitely like how you framed that. Now, with all of that you learn in since you come into the US and just how technology is so readily available to everybody, how we just I would say years ahead of in Africa. With all of that information that you gather, like I will ask you a tough question, really. If you were to advise people back home, whether it's Nigeria, Senegal, or any part of Africa,
Yeah.
how they can actually fast track the progress of the medical field in general, leveraging AI and all of your experience, what would that be?
Oh, I'm excited about AI because it's going to bridge many gaps that exist currently. So for
Right.
those at home, it's just time to learn, get involved. If you have the ability to create, you know, uh, a program, for young folks to get involved and get things going, teaching them on their own,
Right.
really, it's time to get involved in learning in using those open source products. Get your hands dirty, right? Now, reaching out to others internationally and partnering is very key. Not just me, but a lot of people like me exist in the world
Right.
who are in this space and will enjoy the the across the ocean partnerships.
Right.
And I would just want to encourage those on the other side at home. Now, you have a lot to show, to value, to offer, is what I'm
Right.
trying to say. You have so much to offer
Right.
and pride yourself in that. The volume, the people, what is new, situations that is so new that we don't see here anymore,
Right.
so to speak. You
Right.
see that,
Right.
and I'm not even talking of disease conditions per se. And that's an opportunity. Accepting and owning that the volume that we have back home is powerful, right? So self-learning, having collaborative learning through programs, so to speak. It could be after school programs, some hackathon opportunity for interested guys. It could be you introducing healthcare into non-healthcare IT programs and efforts, ensuring there is collaboration and partnerships. And it doesn't have to be with Africans. It could be with anybody
Absolutely.
all over the world.
Right.
Reach out to anyone. You go on LinkedIn, you go and reach out. Emails. The world is very small now.
Right.
So I will want, in such partnerships can create, just find solutions for your own community. It doesn't, and nothing big starts big. It always starts small.
Absolutely.
So think of small, think of that your little clinic. How can I
Right.
use AI to bridge gaps?
Right.
Telemedicine. We have self-diagnosing tools, AI protected self-diagnosing tools now, that could look into your eye and give you a diagnosis. Things that 10 years ago we need a physician, an ophthalmologist to help us define. We have solutions now that would that would give you diagnosis about macular degeneration of the eye or
Right.
diabetic retinopathy of the eye just by one device
Right.
being present. So
Right.
there's opportunities in the West, there's opportunities in Asia, there's opportunity in Europe, so to speak. So please, man, empower yourself by knowing what you're about. Go online, self-teach, understand basics. Think of applying those basics to yourself in your community.
Right.
Look for partners that will help advance your goals, and
Right.
just watch how you flourish.
That's great. I like that. So we're just gonna go easy on this last question. So, uh, are you a reader or audiobook listener, or do you read books? So some people don't have time to read; they just dive into just doing research and things like that. Do you read books?
I am not a classic reader, no.
Okay.
I I found myself, if you tell me this book is going to be good,
Right.
then I'll buy it on audiobook and
Right.
pace myself.
Right.
If the book is so good, and then
Right.
I'll buy a copy. So when I go on vacation, I can take it with me. Um, but yes, I do podcasting. I do a lot of conferencing to educate
Right.
myself and expose myself. Really,
Right.
I do a lot of speaking opportunities because that helps me to.
Right.
The preparation itself is a whole reading effort.
Absolutely.
You
I
know,
agree. 100%. 100%. Yes.
so I take advantage when I'm asked to share my thoughts. I'm
Right.
humbled by the request. Almost always, really, actually, always, I am humbled that when anyone asks me to share my opinion about things that they want me to share my opinion on. So
Right.
yeah.
Yeah, absolutely. You're one of the great minds. We definitely need to tap in. People need to reach out to you via LinkedIn or any other ways that they can reach out to you and just
Mhm.
brainstorm with you and just learn from you. So I think I asked you about that. What would you ask your younger self?
Yes.
Just one thing that you can just share. Well, let me ask the jollof rice challenge first. Jollof rice. Which one do Senegal owns it or Nigeria owns jollof rice? Who
It
owns jollof
depends. It depends on the day when you ask me.
rice?
Depends on the
Okay.
day.
Okay.
But for the sake of the platform and the truth and my experience,
Right.
I'm gonna give it to Senegal. I
Thank you.
will give it to Senegal.
Thank you.
Um,
Thank you.
and I'm honestly not trying to do you a favor. I'm only trying to say the truth, my truth,
Okay.
because first of all, I didn't know
Right.
jollof as a word
Right.
originated from Senegal.
Absolutely.
And you and I have a mutual friend
Right.
who exposed me to jollof as made by Senegalese.
Right.
That was a good experience.
Absolutely.
So Nigerian jollof comes eerie close, eerie close.
I like that
And
you're very objective. I like that.
and don't mention any other countries jollof, please, because they don't matter.
Right.
They don't matter. So I don't want to mention the names. So
Right.
we'll leave the
Right.
war where it's over.
I,
So let's just close that chapter that way.
I'll leave it to that.
I mean, I love
Jollof.
everybody else. All my West Africans, I love you all. I'm just really just joking, but not really joking too, but it is what it is.
I'll leave it to that. So, Doctor, this was amazing conversation. Absolutely, I enjoyed it. We like to keep our interview to 1 hour. So obviously, we could have gone along and just learned so much more from you. But I urge people to actually reach out to you on LinkedIn and whenever possible, if time permits, to
Sure.
establish that connection and that collaboration between you and
100%.
people from different walks of life. It doesn't have to be just our community, people from different
Hmm.
walks of life. So now, what one last thing that you, one last comment or one last word that you have for our audience before I wrap this up?
I mean, my last words will just be that you know yourself, you know what your heart wants. Impossible is nothing. If I'm going to inspire you today, it has to be in bits, slowly. You can't rush through it. The grace over you is much more than you know. So as long as there's life, there's hope. So you want to emigrate to the West, it's possible. I did it. Amodu did it.
Right.
If we can, so can you. So, um, uh, of course, I'm open. Reach out to me if there's anything I can do to help anybody. Honestly, I nothing gives me joy more than being valuable to another human being. So, all the best.
And thank you so much. We truly value your time. This is Saturday. You had a busy week. You could have done anything else. You could have been anywhere. You could have just shut off all of your phone and just resting. But you chose to spend this time with us, and just what an inspiring conversation. From the early beginnings from Nigeria to actually leading a
Hmm.
transformation in healthcare. Your story is really a story of vision and just leadership. So if this inspire you today, just subscribe and share and just leave a review. This is Amadou Cole. This is the opportunity room where every story is a strategy and every opportunity begins with a conversation. So until next time, thank you again, Dr. Fatuyi. Thank you everybody for tuning in to the opportunity room.
A pleasure. Thank you.